All right, good evening, everybody. Thank you for that, Dr. Hernandez, all that shameless self-promotion of mine. But it's really good to be here. Thanks to the committee for having me. Former intern of ours, Liz Saxton. She's the current, played a significant role with the Pain Society of Alberta. It's always great when you see your former students go on to have successful careers and make a pile more of money than you do. So if you need a loan, just talk to Dr. Saxton at the back. All right, so there's my amazing family that Dr. Hernandez talked to you about. My amazing wife, 2 daughters, very cute puppy, a very spoiled puppy, but that's our fault for doing that. So today, the thesis of my talk is going to be really presenting when we have an understanding of the neurobiological foundations of behavior. It can really provide a good pathway for us understanding what interventions are going to be successful. And so I'm taking a little bit of a different approach, but I really want to outline some of those core principles that I think will be helpful for laying the foundation for these interventions. So again, lots of talk about the incidence and the prevalence rates of post-traumatic headaches. Of course, they affect many people, many Canadians, and the way they present is not just, as Chantal nicely outlined, not a simple clinical syndrome. We see headaches, the different types of headaches, we see cognitive difficulties, and then the psychological piece, which is where I'm going to weigh in today. And so a lot of times we have these comorbidities of people who are presenting with headaches. Now, what I'd like to argue to you today is that psychological distress is often at the core of when people are experiencing pain and post-traumatic headaches. And I think that's really important. Now, just again, to reinforce the points of why and where we see this, here was a study that was done a few years ago that was published with a large sample size of people who had had traumatic brain injury and concussions. And so you can see the sample size there. But what's interesting is that when we look at the symptom report, of course, the number one symptom was headaches at the bottom, but we also get these symptoms of not feeling right. Do you ever not feel right for whatever reason? It's hard to describe. It's hard to put in words, but there's usually an element of distress. And so you can see that irritability and frustration is a common outcome that's comorbid with post-traumatic headaches. Well, let's explore that a little bit. So when we look at the brain and how our brain systems work, we have our 2 basic systems, the sympathetic system and the parasympathetic system. Sympathetic system, of course, is important for arousal. So when you have a big project, when you're engaging in a sport activity, you need to be energized. Your body needs to get going. And so the HPA axis, of course, is really prominent in the activation part of our response. And so the flight or fright response, and from a cognitive perspective, again, we tend to see what we call tunnel vision. The increased levels of cortisol in the brain allow you to focus. So you know what that's like when you're kind of hyper-focused. For example, if you're preparing for a talk to the Pain Society and you're really focused because you want to get it done on time, you know that you're pretty dialed into getting that done. Contrasted with that is the parasympathetic system, which is a rest and digest. Now, what's interesting, and I think there's 2 worthy points here, is that these 2 systems are anti-correlated, which means when one is working, the other is not. You can't be stressed and relaxed at the same period of time. You can't be on a beach in Hawaii and really stressed at the same time. Your breathing, your heart rate, all those kind of things, when they're aroused or when your sympathetic system is activated, you're going to feel that surge in blood pressure and all those things, contrasted with parasympathetic. What's interesting is we can also make a conscious choice to engage in activities that either increase the sympathetic system or increase the parasympathetic system. You can choose to engage in activities that are helpful with relaxation, or you can choose to engage in activities that arouse or involve the sympathetic system. Now, there's a lag between the onset, but it is a choice. And that's where it's interesting when we look at human behavior and specifically psychological approaches, we want to reinforce people engaging in behaviors that facilitate that choice. So again, those of you that have any sense of being stressed at some point in your life, you know that there's this interesting conceptual overlap between pain and distress. So physiologically and conceptually, we see that there's a lot of overlap when you're stressed or when you're in pain. There's been some really great papers of late that talk about chronic pain and chronic headache pain that's associated with increased cortisol levels. So we know when people have headaches, they tend to be distressed. And when you're distressed, as you can see, there's a lot of things going on in your body. Muscle tension, all right, increased adrenaline, increased energy consumption, all those things that are happening when you're stressed. Now the body's stress response system, when it's overtaxed, when your sympathetic system is over-aroused, we engage in escape behaviors, hence the flight or fright. So those of you that have had headaches or work with people with headaches, what do they tell you? They come home at night, all right? They get involved with their busy families, their kids are screaming, and they want to escape. They just want to get out of that environment because of the elevated level of the sympathetic system. And it's hard to make decisions when you're stressed, because when we look at how people function under states of distress, your decision making is not as strong. You don't make great decisions under stress. The more you're in pain and the more you're stressed, the more you're going to make decisions. And again, we would talk about medication overuse. The habits that we develop to get the quick relaxation fix are pretty paramount. Now, the other part that's interesting is when we look at brain-behavior relationships is the part of our brain called the anterior cingulate. The anterior cingulate is a region of the brain in between the limbic system, your emotional processing, and your prefrontal cortex, which is your decision-making. So it's the part of our brain that's involved when we feel conflict. Some people call it the shame circuit. So maybe you've been in a situation where you're on your way to go somewhere, you're a little bit late, and somebody out of nowhere comes and starts talking to you. And they keep talking to you. And you're feeling that inner tension of, I gotta go, but I can't be rude, what do I do? And that inner state of conflict. Or in better examples, you planned a trip to Hawaii, and your in-laws call and say they want to visit you at the same time. A clear sense of inner conflict. When people are in a state of distress, there's overactivity in the anterior cingulate. There's a lot of conflict. And when we break down the cognitive side of anxiety and depression, people who are stressed and in pain have a lot of conflict, have a lot of negative emotion, which again relates back to what we understand of what is going on in the brain. Again, we can see the impact of stress or a stress state or a pain state of cognitive functioning. Your increased alertness to threat detection, little things bother you, right? Your child that normally you love, but when they're screaming at you, it comes across as a threat to you and you don't react well to it. Your focus is narrowed. It's really hard to be present, relaxed, and in the moment when your arousal systems are overly activated. So we see this kind of interesting dilemma when people are in distress of this tendency to be over-aroused where your sympathetic system is over-activated and our parasympathetic, again, they're anti-correlated, so that means that we tend to be in the stress state. The great thing is, when we think about different approaches, including psychological processes, the choice to engage in restful parasympathetic activity becomes really, really key. And that's the goal, is we want to activate this rest and recover system because our default under stress, under pain, is the sympathetic system. And that's where we introduce some of the psychological approaches. Again, there's a lot of different approaches that you're going to hear of this weekend, but mindfulness meditation, cognitive behavior therapy, and I'll talk a little bit about purpose and meaning. So quickly, mindfulness meditation has gotten a lot of press and for good reason. Mindfulness approaches start with a deep breathing approach. So when we learn to take our good deep breaths, we are engaging our rest and digest system. And we actually find that even 10 minutes of engaging in just deep breathing activities activates and deactivates the sympathetic system and activates the parasympathetic system. And that is under conscious control. It's hard to breathe and to think about our breathing when you're stressed, but you can do it. And that's why when we engage in these helpful therapies, getting people just to breathe, and not just breathe shallowly. Most people, 85% of people, will breathe in their chest. And we could do some activities if we had more time to breathe, full lung breathing where you're incorporating your belly muscles. It's actually pretty hard. We're born with the God-given right to breathe, and yet to breathe properly, breathe well, is a skill. You actually have to learn to do that. Mindfulness, the topic of mindfulness, again, it's broad, but the basic definition is what you see there. It's a training, so that means you have to work at it. You have to practice it. It's not going to come automatically to you. It's a non-judgmental attention to present moment experiences. And probably in this audience, maybe a number of you are engaging in these mindful meditation practices. And that's great. In a busy world, believe you me, I think we need to do more and more of this. So when we incorporate these practices, it's helping our biology. It's helping make that shift away from the sympathetic and into the parasympathetic. And when we look at the brain studies and what the positive impact of mindfulness meditation with the ability to use fMRIs to look at brain functioning, we can see, our suspect part of the brain, the ACC, we see that by engaging in mindfulness meditation, it allows us the level of conflict that people experience and the level of activity in the ACC diminishes. There we have the brain biology that's helping us understand that this is a good thing. And you can see when we engage in mindfulness activities, it improves our emotional regulation. So this is why practices and therapies that involve, think of 10 minutes of your day engaged in deep, meaningful breathing exercises. How that could be positive and have a positive impact on not only your mind state, but also your pain behaviors. So again, you can see the number of positive effects from that. Oops. All right. Here's a recent study, a meta-analysis that really reinforces these main points. When people engage in routine mindfulness activities, you can see that the reports are improvement in cognitive functioning. Wouldn't that be nice if you could just automatically improve your cognitive functioning, your physical health, so the various markers of health, related quality of life, and your levels of fatigue and depression, which are really common in post-traumatic headaches. Those improve by engaging in regular mindfulness activities. Just a little point about the cognitive behavior therapy. I'm not going to spend a lot of time on that, but when we look at people who engage in cognitive behavior therapies, when you have post-traumatic headaches, we can see that there are significant improvements in overall functioning. And you can see this was a study that was done a few years ago with individuals who had both post-traumatic headaches and PTSD. And we saw that by engaging in mindfulness and cognitive behavior therapy, after 8 to 10 sessions, people were noticing significant improvements. 8 to 10 sessions, that's pretty good. We're talking about 2 months of treatment if you go about every week or so to see these kind of improvements. So again, it makes sense that this is helpful. The last point I want to talk about is when it comes to suffering and pain. Pain, there's a suffering element, and it's no fun. And there's a unique area of study that looks at these acts when people are able to do things that are really incredible. And so this was an example in Utah of an individual that was run over by a vehicle and he was stuck under the vehicle. And somebody, a bystander, came along and actually lifted up the truck to save the person. Now, what's interesting is that when we look at this, we call these acts of historical strength. If you ask the person the next day to come back and lift up that van for $10 million, they would not be able to do it. So what is it about that allowed a person to do something that took incredible amounts of strength? And so there's a few researchers, and Marcora is an Italian researcher that's looked at this, and Marcora says that the way we approach pushing through pain and suffering is we can increase, by increasing our motivation, it allows us to increase our level of effort. And you know this, that if you have an easy task, right, your level of motivation is not that high. But when you have something very challenging, right, you tend to put more effort. You're willing to push through more pain and suffering. Now, how do we adjust this? I think there's a really fascinating study that they did at Penn State, and I call it Lessons from Janitors. And what the purpose of that study was they went to janitors who were working in hospitals. And specifically, their job was to create a cleanly environment in a hospital setting, where there's lots of germs, lots of bugs, and so on. And the intervention is that they went to a subgroup of these janitors, and they talked to them about the spread of infectious disease. They talked about how these can have real negative impacts, especially on children. That was the intervention, just to give them an idea that what they did was important. What they did had meaning. And when they looked at the results from that 6 months later, the incidence in quality of work, the incidence of missing work went down significantly. So we saw these significant changes in behavior. Why? Because these janitors were reinforced for giving a why and a purpose. And when we talk about people who are dealing with chronic pain and chronic headaches, well, what we know is that sometimes they're just searching for, how do I get through the day? What is my why? And when they connect with the why, where I want to be strong for my kids, I want to engage in these other activities, I don't want to be limited by my pain. When they can connect with that why, it provides a powerful motivator that Mark Horer would say increases your willingness to push through thresholds. So I think a very interesting finding when we look at the behavior of how people are functioning. So that's the end of my talk there. Again, just in quick summary, psychological approaches I think are really benefited when we understand the biological side of it. Activating the parasympathetic system through mindfulness activities is shown to have a lot of promise. Cognitive behavior therapy as well, and finding your why. Thanks very much.